So I think it's important that whoever is trying to manage an anxiety disorder knows enough about managing the condition. This would mean having the time to elicit a detailed history, and also the time to explain to the patients and educate the patient and the family members about the medications and the support systems that are required to help the patient. And also the ability to recognize, if it is a physician who is trying to manage an anxiety disorder, the ability to recognize that at what point they are no longer able to help the patient and refer them on in the right way. So I think that would be, that would be important, and it's the same as with any other condition. I mean, physicians treat a lot of other conditions, and it's at that point where they realize that the complications are too many, or the symptoms are too severe, that it is going to require a specialist to look at the symptoms and to be able to advise and medicate from there on. I think routine plays a very important role in all our lives. Sometimes, you wonder what life would be like if I had no timetable to follow, if I had no clock to see, if it didn't matter whether it was day or night, or whether it was, the 20th of December or the 22nd of December. I had no meetings to attend, or I had no kids to prepare and get ready for school. What would life be like? It would be very different, and it would probably have a lot of vacuum there. I mean, you wouldn't know what to do with your time, because time just doesn't seem to go. It's slowed down. A lot of patients with anxiety seem to experience that vacuum because there is no structure. And one of the best things that we can do for them is to provide a structure, help them get that structure back into their life. All of us feel this need to have a sense of purpose, and without that sense of purpose, you wouldn't want to wake up in the morning. You wouldn't know what you're waking up for. And being alive without a sense of purpose, without knowing what you have to do, can cause a lot of anxiety. So that's the role of structure in our lives. And if there is a person who is living by themselves, is retired, doesn't have many hobbies and interests, not socializing, it becomes our biggest challenge would be to create that structure for them, with them, and find the support systems available around them, the resources, put them all together to give them that structure. It would certainly go a long way in allaying their anxieties, because it gives them control of their time again. So people can care for themselves by, one, if they are aware that there is something different about them. This is not how I was. I am feeling this sense of restlessness and agitation. If they are able to recognize this as a symptom of anxiety and are aware of anxiety in itself, then perhaps they can try and put that structure in place themselves. But if they are not able to, then it is important that they seek help. They go and talk to a medical professional, either their general practitioner who knows them, or a family member who knows them, and be able to tell them that, come, let's just get some help, because this is not who you were. There's definitely something different about you. You were able to do so many things previously, but now you seem unable to concentrate, unable to, sit and read a book for long enough, unable to go out and do the things that you were doing. So there is something very different about you right now which needs to be addressed. Another way in which people can try and help themselves manage their anxieties would be to be more mindful about what they do, what they feel, and the things around them. It certainly seems to make a huge difference in trying to in bringing the anxieties down. Simple exercises like, when you start feeling the anxiety very strongly, then just stop for a minute and focus on what's around you, maybe a few things around you. Think about the sounds that you hear, the smells that you can smell, what you can feel inside of you, and focus on that. Maybe even trying to write down your thoughts can help. A lot of people find that if they're able to use their mind and their hands at the same time, it makes a big difference in bringing the levels of anxiety down. Regular practice of yoga, exercises like the pranayama, deep breathing, would also help in calming persons down. you can bring these, you can start applying these when the anxieties are really high, as opposed to, the anxiety will not be the same level the whole day. It will be more intense at certain times of the day, and those are when you can probably start using these techniques to calm yourself down and distract yourself, to cut that train of thought which doesn't seem to be going away, and find something else to focus your attention on. It certainly helps to bring anxieties down. It can, and it's, as I said in the very first part of this interview, it is a normal response. So we are not looking for it to disappear completely. What we would be aiming for is it to stop becoming an impediment to our daily routine and to our day-to-day functioning. As long as it is not interfering with what I do, and as long as my anxiety is limited to a certain area or a certain problem, and it is short-lived, and once that occasion has passed, I no longer feel the anxiety, then it's fine. It's a normal response. So we're not looking at eradicating anxiety completely from our lives. We're just looking and hoping that we can make that anxiety more functional and not harmful and stressful in terms of the excessive worries that are associated with the anxiety. Sometimes we notice that our relatives or our friends or our neighbors are not who they used to be. We may have noticed small changes in them over the last few months. We may have realized that this person used to come for a walk every day in the evening is no longer doing that, or he used to probably pop his head around and say hello to the kids is no longer doing that, particularly in people who are living alone, because there's no one else to point it out to them. And if you notice this, so you notice this about your own family member, perhaps every time people come visiting, they withdraw themselves and go off into the bedroom, there is something wrong, and it isn't a part and parcel of age itself. There is no reason for them to suddenly think that they no longer belong, or not do the activities that they used to. So if that's the case, there is no harm in going and speaking to the person and asking them what's wrong. Often elderly people feel hesitant coming and telling you what's happening. They feel that they're already burdening you enough. But it's important that we go and ask them, and we're not going to create a new problem by asking them how they feel and whether there is something wrong, because you have noticed that there is something different about them, and that might help them overcome their inhibitions and share with you whatever it is that they're going through. And then you can address it in the appropriate manner. Either you look at some of the non-pharmacological interventions that were discussed earlier, see if any of that is the reason, if the lack of routine, as we spoke about earlier, could be established, and if not, then of course try and seek medical attention, speak to the general practitioner or to the psychiatrist, and see if these problems can be addressed.